And I asked what my first appointment was going to be like. Like, what do they even do? Is it like a gynecologist appointment? They do blood testing. They test my pee, make sure I don't have like a bladder infection. They do blood pressure. They do a pelvic exam, which I need to learn a little bit more about exactly what that entails. I think they said they could offer a pap smear, and I'm not planning on getting a pap smear right now. I don't really want my area scraped around in there right now. And I asked them also about the brown discharge thing, and I told you that last week, what they said. And then I also asked too, because one reason why people get ultrasounds is so they can see if there's a chance that their baby might have Down syndrome or things like that, or different abnormalities with developmental stuff. And of course, we wouldn't be able to tell via a blood test, like a genetic test with the baby cells floating around in the blood, if the baby's like, arms weren't developing properly or something like that, for like just a, congenital issue, not like a, genetic issue. But you can do blood tests, usually around, I think she said around 12-ish weeks. I need to look more into that to see if there is, a genetic, like trisomy or, different autisms you can tell in your genes. So that's something that I think I like to do because it's not invasive. It's just me taking my blood because their baby cells are floating around in my blood, And then we ask them, like the total bill, like there's an out-of-pocket fee and then there's a fee for insurance. It's different. So we asked about that. We asked about just like how they test my blood sugar. They do the glucose test. They'll do that later on. And so that was kind of the overview of the things we asked for the prenatal and appointments questions. And then for the birth questions, I told you before, I asked about if like after 42 weeks you have to deliver at the hospital. But the good news is, I forgot to mention, the hospital doesn't have a policy where they like require, as if anybody can require me to do anything. That's not fair. That doesn't make sense. To be induced. So they're not going to try to really force you to be induced after 42 weeks. You just have to deliver at the hospital, which is really good news. Also, I asked about breech birth because I don't think that would happen to me. It's not super, super common, but it can happen, that you can't deliver a breech birth at the birth center, but they also won't allow in the hospital vaginal breech delivery either. They want you to have a C-section. So that's the only real issue I'm having right now, but it's also a low chance and we have a lot of time to think about it. It doesn't mean I wouldn't choose this birth center. I really like them a lot. And then I also asked about like if labor happens and there's a lot of meconium in my water when it breaks. And meconium is usually when the baby's been in there post-date a little bit longer as opposed to earlier. It might poop in the water because its body's starting to work. It's getting ready for life outside the womb. And I wondered if there was meconium, if it would mean an automatic transfer. One of my clients had meconium in her water, but it didn't mean an automatic transfer because it wasn't very much, and the baby seemed fine, heart rate was good, all of that. So she said that it depends on how the baby's doing. It's not an automatic transfer, even if there's a good bit of meconium, which I like that. They're doing evidence-based care taking. They're paying attention to the health of the baby and the mom, and they're not just following random rules, And I asked how many people for a birth I could have with me. She said a bazillion. They've done no one except the partner, and they've done tons of people, And I also asked about their hospital transfer rate because I was looking at the numbers, the percentages. They have a 3% C-section rate and an 8% maternal transfer rate. And so I was wondering what that was, because clearly if it's the 3% C-section rate, it's all the transfers aren't for C-section. The majority of them are for maternal exhaustion, which would be maybe the mom has been in labor for an entire day or longer, or maybe less long, but she's just so exhausted and she can't sleep and she needs to sleep and she's not progressing. And she's like, I can't continue on without pain medications. Because in most birth centers, they don't have pain medications. And that's one reason too, if you're trying to have a natural birth, to birth in a birth center, because the option isn't there, which maybe you think, oh, but I want the option and I'm going to try natural birth too. But really choosing your place of birth is like the biggest thing I've noticed. And I can just tell through the way it's been with clients and things like that, is choosing your place of birth is the biggest thing about the way you are able to, if you want to do a natural birth, do a natural birth. Because, I don't eat carbohydrates, but if I had like a fridge full of delicious cookies, I would totally eat carbohydrates I would eat them all day. I mean, I would do that. I mean, because it's there. So like, you know, it's sort of some sort of kind of pre-self-control where you're like going to keep yourself away from that to help not have it. You know, not a lot of people have that kind of self-control where when it's right in front of them, they'll just say no, no, no for epic amounts of time. I think you just have to kind of foresee how you'll be and foresee that, oh yeah, it's going to hurt. It's going to be hard. And if you really do want to do it naturally, is putting yourself in a place where you don't have the option to get the drugs unless you want to do a hospital transfer because, you know, because you really just can't take it. Okay, then, you know, so anyway, so it's mostly for maternal exhaustion and needing to have like an epidural or something so they can sleep because they have no energy and they're just feeling horrible. And so I also asked about like a limit on how long, like I could be in labor before I got transferred, you know, to the hospital or something. And I talked about, you know, laboring in the water because they have birth pools and things like that, and how long they needed a heads up to set up the pool, you know, 15, 20 minutes to fill it up is what they said, but it's always set up in the room. And I asked about like if they require or, you know, have any certain vaccinations or baby shots or shots for the mom that they require, or anything. And she said, no, they don't require anything. And she said, there's a waiver for everything, which means you can say no to anything, which is a good thing because it should be up to you. You should say yes to everything if you want, or you should say no to some things, or, you know, it's about your care. It's not about people telling you what to do all the time. It's about you deciding what's best for your baby and people respecting that. And I'm really happy with this birth center. I think they're totally going to do that. And I've seen them do that in past births when I've been there. And then I also asked about if you go into labor before a certain point or after a certain point, if you have to be in the hospital. And I told you 42 weeks is the cutoff. You have to go to the hospital if it's after 42 weeks. And if it's before 37 weeks, you have to be in the hospital. So you've got a 5-week window. And the huge majority of babies are born in that 5-week window. And how long would I get to deliver my own placenta before they'd have to give me like drugs or, you know, things like that. And that was a certain amount of time. And you know, things like that. So those are the kind of questions that I thought were important to ask, because others I already kind of had answered through being there and seeing the two different main midwives birth clients' babies. And so I already had a good idea of how they roll. But I hope that list helped you a little bit. And if nothing else, just remember that you have the right to ask anything you want to ask and take up as much time as you need to take up, you know, but of course, you don't want to, you know, take up a lot of time and be rude and stuff, you know, you want to be considerate, but like, still, I mean, they're there for you. And in most cases, they just love answering questions. The midwife that I talked to said, oh, I love answering questions. Like, it helps me, it keeps me on my toes, you know, about like what we do here. And it's nice to be able to answer questions for someone that has them. And so, I mean, that's just something you really want to hear, is your care provider saying, I love answering questions. Keep asking. That's important. So that's kind of the 8 weeks, how I'm feeling right now. And thanks for listening, and I will update you at 9 weeks. Okay, thanks. Bye.